Now that you've heard about the disorder from a textbook standpoint, we want to bring you to the personal life of someone who has the disorder. We were able to talk to Angela McKean, the mother of Angela McKean, one of only 500 people in the world who actually has the disorder. When asked about her life, this is what she said. Allie seems to take everything in stride. There's only been a few occasions where she shows that it is bothering her. She knows that this is her life and she's pretty much accepted it. I honestly think, other than the day we find out, the hardest things are not only watching this, but the days when the pain is so severe that she just cries and nothing helps it, and all I can do is hold her and try not to cry myself. There is no way to express to any of you the amount of physical and emotional pain that comes with FOP. It seems that it is an emotional disease as much as it is a physical one.
When asked to take us through a day in her daughter's life, this is how she responded. Well, they are fairly boring and differ from day to day depending on how she is feeling. I can tell you that the first thing we do every morning is have her tickle the sky to make sure her shoulders do not lock up overnight. Sometimes the pain she feels through the night causes her to wet the bed, so of course, if that had happened, we would be cleaning her up. When she gets her baths, we do a full look over of her whole body, looking for new flares, signs of one beginning, checking for any bruising, signs of lockups, etc. She is unable to do most of her own hygiene, and once she is out of the tub, we apply custom medication for pain and inflammation to every flare area. Sometimes when the pain is too much, she will also go on ice packs, but we check daily for movement and new flares.
When we asked Miss McKean how she discovered the disease, she responded with, Allie was born with malformed big toes. At 4 months old, her pediatric orthopedic surgeon told us she had a partial duplication within the joint that was 100% identical, only mirrored on both sides. After the doctor diagnosed, he wanted to operate, saying she wouldn't walk again if we didn't. Well, we didn't. If we had, she may have never walked a day in her life. When Allie was learning to walk at 1.5 years of age, she fell and hit her head. Her neck popped and things started to escalate from there. It started getting stiffer and stiffer. She had a spinal tap for meningitis and was later diagnosed with the subluxation of her C1 and C2 vertebrae. Shortly after, her surgeon said no, she has clipophilia. Then in the beginning of last year, they told us that she had multiple hereditary ectosis. In March, she was admitted to a children's hospital. 30 different specialists came in poking at her, saying she was a cool patient, but they didn't know what was wrong. We didn't feel any of these doctors were right. It just didn't fit. So we transferred her down south to a different children's hospital and saw a geneticist who looked at all of her issues as one. The earlier the diagnosis, the better. Prevention for trauma needs to be put in place. With all of Allie's misdiagnosing, the several MRIs, CAT scans, intubations, and surgeries made her all worse. We do not know how different she would be now if we had known when she was born that she had FOP.
When asking Ms. McKean, is there any physical activities that brings joy to Allie, she responded, Allie has lost 30% of movement in her shoulders, 90% in her neck, 100% in her back, and all range of motion in her hips and legs. Physically, we're trying to keep her from running too much because her body is very unstable and she isn't quite used to how it moves yet and the fact that it's starting not to work. For example, she was walking and just fell forward. She couldn't catch herself because of her current shoulder flare. It seems that this is very common among children with FOP. If you ever get a chance to meet a child with FOP, you'll understand how amazingly incredible these people are. They have such love for life and almost unrealistic beliefs. Allie herself loves sandboxes, dollhouses, sunshines, and beaches. The only thing Allie does not like is spiders. With research from institutions like the University of Pennsylvania and donations to Allie's Army, we can help combat and knock this disease out so that no other person or child will ever have to suffer with FOP ever again.